Congresswoman Underwood, just another problem you're working to tackle, and it's a problem that has really been underserved in many ways, and that is maternal mortality, especially in the African-American community. Tell us, you're rolling out the Momnibus bill, and it's actually 9 bills trying to attack this problem. Tell us about it.
In the United States of America, black women are 3 to 4 times more likely to die as a result of childbirth in this country, a statistic that has remained unchanged for the last 3 decades. And the United States is actually leading the industrial world in this elevated maternal mortality rate. We need to be investing in this perinatal workforce, solving some of the mental health challenges that women face. And, you know, there's a lot of conversation about postpartum depression, but there's also, you know, anxiety, there's other mental health disorders, there's substance use disorders, and we need to make sure that there's a targeted, focused effort on solving those new moms' challenges there and giving them the resources to do so. This is a crisis for all American women, and it's especially pronounced for black women. Behind each of these alarming statistics is a tragic story. Stories like my friend, Dr. Shalon Irving, a CDC epidemiologist and lieutenant commander in the United States Public Health Service Commission Corps, who died 3 weeks after giving birth to her first child, a beautiful girl named Soleil. Stories like Shiphrah Johnson, who you'll hear about from Congresswoman Adams. Today it's for Shalon, it's for Shiphrah, and every other mom who's lost her life or come close to it trying to bring a life into the world. I am proud to be the lead sponsor on the bipartisan Protecting Moms Who Served Act, which ensures that women who have worn the uniform of the United States can get the prenatal and postpartum care that they have earned. The other bills are led by fearless members of the Black Maternal Health Caucus, who you'll hear from today. From centering the voices of people who have been affected by this crisis to collaborating with community-based organizations, patient advocacy organizations, think tanks, providers, hospitals, and insurers, we built a broad coalition. And we are grateful that the Momnibus has been endorsed by over 100 organizations.
For me, this work began when my daughter, a black mom herself, survived a complicated pregnancy that almost claimed her life. I also want to take a moment to speak about the bill that I'm leading within the package, the Shiphrah Johnson Act. Shiphrah was an entrepreneur. She traveled the world, and she was a mother to a healthy little boy. On April 12, 2016, she checked into a hospital with her husband, Charles, to give birth to their second child, Langston. Despite being in excellent health, Shiphrah did not make it out alive. Shiphrah Johnson mattered. Shiphrah deserved better. And this legislation says unequivocally that black moms matter.
Yesterday, I introduced the Social Determinant for Moms Act. This legislation will harness the power of the federal government to address the social and economic factors that lead to negative outcomes for maternal health and address some of the disparities that are seen in maternal health throughout all of America.
And we have to hold our medical professionals and our healthcare system accountable for making sure that we are not just dealing with the issue of quality, but we're talking about equity of care.
For new mothers of color, a mental health crisis already plagued by stigma and stereotypes compounds the deeply entrenched racism woven through our maternal health system. For two systems, both in desperate need of dignity, equity, justice, the Moms Matter Act will bring just that. We'll establish a task force focused on improving mental health and substance use disorder outcomes, and back that talk up with action by providing federal dollars to implement best practices.
I'm proud to introduce the Data to Save Moms Act, which will improve data collection to better understand the causes of maternal health the maternal health crisis in our country, and will inform the solutions that we need to address it. Importantly, it combats the shameful mortality rate for Black moms and Native moms. It helps ensure that we have a full picture of the maternal outcomes for all women of color.
80% of incarcerated women are mothers, and 5% of incarcerated women arrive at prison pregnant. These women are usually most at risk for maternal health complications, denied critical bonding time with their newborns, and face physical and mental health complications exacerbated by inadequate health care. The Justice for Incarcerated Moms Act would help to change that by creating systems to protect the health of incarcerated women and list them as partners in our fight for justice and equity.
One of my bills, the Perinatal Workforce Act, was included in this fantastic Momnibus package. And so this bill would provide grant program for doulas and midwives and lactation specialists, Black nurses, and to try to make sure we diversify the workforce.
The solution of the Momnibus must be understood in the context of America's history. Because if we are to do what is right going forward, we must remember where we have been. And then understand in that context what the leaders on this stage are doing to create a path that corrects while acknowledging what has been done and what needs to be done going forward. I am so proud to stand with the leaders on this stage.
Black maternal health is not a partisan issue. It's a life and death issue. The main goal of the caucus is to develop and advance evidence-based policy solutions. And today we've met that goal.